A counselor is for emotions, a psychologist is for moods and mindset. A therapist is for unconscious behavior patterns, and a psychiatrist is for mental illnesses. Hello everyone, you're watching Matters of the Mind. In this video, I'm here to help you find the right mental health professional for you. Choosing the right mental health professional can be challenging and sometimes confusing. Watching this video will help you unburden yourself from that confusion. So if you're looking for someone to talk to, someone who doesn't judge you, or someone who would listen to you without interruption, then you need to speak with a counselor. Do not go by what the issue is. Go by what is it that you want, that you require at that moment. If you're looking for someone who can just listen to you, where you can vent out whatever is piling up inside you emotionally, then the counselor is the right person for you. Counselors have excellent listening skills. They provide unconditional relief, and if you're struggling with pent-up emotions, they can ease that too. If it's just about venting out, I might do it with my friends and family. If you have friends and family like that, great, awesome. But then most of us, we come across people who utter statements like, I cannot believe you did that, or someone who just say, you're blowing things out of proportion, or someone who just look back at you and say, are you crazy? What were you thinking? And that's all it takes to make or break a person emotionally and mentally. So this is a key difference when you go to a counselor. They listen. And they listen with such intensity that they bring all your focus and attention in such a way that it increases your self-awareness. They help you scan your thoughts. They're trained to help you examine your emotions. And this is a huge milestone in the process of your inner journey and the way you experience your life. Counselors are professional listeners with a diploma in counseling or bachelor's or master's degree in psychology or social work. Volunteers from ASHA are doing excellent work in rural communities spreading awareness about mental health. Now, a psychologist comes into picture when what's going on inside your mind begins to manifest and impact your life externally. For example, for someone who has very good work ethics, suddenly they start experiencing poor performance, turmoil in their relationship, aggression and confusion, and that leading to overall perception, memory, concentration and interpersonal mismanagement. The psychologists here are experts in change management. They can make your entire transition smooth and effortless. Psychologists are individuals with master's degree, either an MA or an MSc in psychology, whether it is organizational psychology or general psychology. A therapist is a person who is an expert in dealing with emotional trauma that affects a person and leads to deep-seated issues or even personality disorders. These are people who have done their masters in clinical psychology with expertise in psychometric assessment, or someone who's done their masters, like in my case, in general psychology, but have a specialized certification in psychoanalysis or psychotherapy. The term counselor and therapist are interchangeably used in the field of mental health. You need to visit a therapist if it's a case of substance abuse or a case of personality disorder. Studies just show the results are better when a therapist intervenes in such cases. And therapists are experts in dealing with unconscious behavior patterns. Psychiatrists are medical doctors who are the experts in mental health. They diagnose and treat people with mental illnesses. As physicians, they are the only ones authorized to prescribe medication after having examined the symptoms of the case study. Psychiatrists treat people with mental illnesses like schizophrenia, bipolar, eating disorders, or addictions. A psychiatrist steps in to provide urgent care for sudden mental illnesses or to help you deal with a long-term mental health condition, or they can help in admission to hospital when there is a requirement. Now, a psychiatrist can help you, especially if your case is complex and very difficult to diagnose, like instances where there is a lot of violence and self-harm involved, like the case of suicidal ideas or plans. Now that's where a psychiatrist can really step in and make a difference. If a certain mental distress is severe or happens suddenly, then the person must take the medication prescribed only by a psychiatrist. So typically, a psychiatrist would spend about 20 minutes with a patient to diagnose and prescribe. Whereas the counselor, psychologist or a therapist, they spend about 1 or 2 hours with a client, and the difference in the time spent with the patient or the client is due to the difference in the approach and treatment style and not due to the lack of expertise. If it is about venting out, go meet a counselor for relief. If it is about coping with change or a decision that needs to be made, go meet a psychologist for better results. If it is a habit or a pattern that needs to be broken, seek the help of a therapist who can help you with the unconscious behavior patterns. Or if it is something that you're not able to articulate and you're not sure what exactly it is, seek the help of a psychiatrist who can help you diagnose the issue better. You cannot go to a psychiatrist and expect them to spend 2 hours with you. And similarly, you cannot go to a counselor asking for a quick fix medication. The right expectation is one step closer to your well-being. Thank you for watching this video. I hope it was informative enough to seek the right mental health professional. This is Matters of the Mind. See you soon.